Yeah, there was a little bit of a rush when I had to run down from the room to get into scrubs and on time in the operating theater, so I forgot my caliper. But that's okay, because we can use the landmarks in the face to actually find the golden ratio spots. So what I did was I took a Q-tip and there it is. I'm sorry. And there is the intercanthal distance. Okay, so there you have it. That's our 1. And this is our 1.618. Okay, so this is the length of the nose, is the width of the mouth, it should be the length of the eyebrow, while our 1 is actually the distance from the starting point of the eyebrow to the top of the eyebrow, while our 1.6 is the whole length of the eyebrow. Now, why did I want to show you this? Because basically, we're following up on Arthur with his amazing beautification theory. So, what I would like to point out is because we're focusing on the midface, we have to find that special spot. From the nose, from the ala, it could be anywhere from here until, use it as a caliper until here. So basically, it could be anywhere here. From the canthus, we can also make a circle, and where they cross, and that's a bit hard to show that, but it's going to be here. Actually, from the lateral side, you can really appreciate what she needs. You see that she has some mid-face deflation right here. She has relatively good cheekbones, and obviously she could be a candidate for the lower face session as well. As you can see, she would definitely benefit from a more of a projection of her chin. I think her nose looks very good. Her lips and her nasolabial folds don't need any attention, or like very little attention. Basically, she's a perfect patient for what I like to call a liquid mini lift. So the 2-point technique, focusing on the first injection and second injection point. So I've drawn the lines already. This is the alar tragal line. Above the line, I inject on the periosteum, deep below the smas. Underneath the line, I inject superficially to induce collagen neogenesis in the skin, to tighten the skin, to make it hold the fat compartments in their place. I've wiped off the marker. But what I did, I drew the alar tragal line. Then, just in front of the hairline, I drew the superior and inferior demarcation line of the zygomatic arch. And in between, at the apex of the zygomatic arch, there is the first injection site. Now, why do I use that injection site? It's because from here it's very easy to fan. And what we saw from Robert Shaw's research is that especially in the infralateral side of the orbit, there's the most bone resorption. So I will lift up a little bit the skin, and excuse me, you're standing in front of the monitor. Okay, so I lift up the skin, so I'm not intravascular. I just give her a small blab. That's all she needs. Also over here at the crossroads, I find my second injection site. I just very superficially give her just a little bit, maybe 0.1 in total. That's it. That's all she needs. Okay. Now, in an ideal world, we would give her maybe a minute or 2. But of course, we are on a schedule, so we have to continue. And I take a 25 gauge needle. Okay, see, there's a little bit of blood here. So that's where the anesthesia is. And I put the tip of the needle into the skin. That's it. I'm not going any deeper because I don't want to make any bruises. And now I have a 27 gauge needle, cannula, and I will place the cannula into the small opening that we just made. So here we go. Placement of the cannula into the dermis, and it's going through the dermis. Sometimes there's some resistance in the dermis, especially if you use the same thickness cannula as the stab needle. So if you want to pass the dermis, you can stretch the skin open, and you can pass the dermis easily. Then once we're underneath the dermis, we have to go through the smas to get to the deep layer. the deep level. And to do that, I lift the skin up above the area that I want to treat. So I lift the skin and I push. Okay, as you can see, there's some resistance. Now this is a trick. So if you pay attention now and you look at what I'm doing, I'm rolling the syringe and then I press again. So I don't need to use any force. I just use, I like to call it the pencil rolling technique, because it's like rolling a pencil between your fingers. How's our patient doing? Are you okay?
Yeah.
Yes,
What size
she's
cannula
okay.
did you say that was, Jani?
What's up?
What size cannula is that?
That's a
27,
27G. Okay. Okay, I always check where is the tip of the cannula. And it's right here. It's touching the tip of my finger. Okay, so what I'm going to do now is I'm going to inject like a small bolus. It's like 0.05.
Is your radius thinned out at all, or is it, what's the concentration of your radius?
This is pre-mixed with 0.3 mLs. Then at the sexy spot, I give 0.1. I retract again, maybe not even a centimeter. I give 0.05, and I give 0.05. Now here in the lateral part, she's already good. I don't feel that she needs any extra projection, because especially Asian people have very, very good prominent cheekbones. So I go back a little bit more inferior to that. And as you can see, twisting the cannula for easy access. Think of it as a drill. If you want to drill a hole in the wall, you need to turn on the drill. So there's another small bolus. I draw back. I give another small bolus. I'll draw back and another small bolus. Okay, I feel like I haven't treated the infralateral side of her orbit enough. So I go back to that superior place. I lift up the tissue again. I twist and I advance the cannula. I lift and I twist the cannula. And then I'm sliding over the periosteum. And over here, because the tissue gets a little bit thinner, I just give her a linear thread. Here, another little bolus. Okay. So that's our first little bit of volume that we put. We put 0.5 in total. Yes, there we go, through the skin, and now we have to go through the smile. So as I said, I lift up the tissue and I go in between the infraorbital rim and the infraorbital foramen. That's my direction. So I go through the smas, and you feel that the smas is giving, there we go, through the smas. So now I'm just superior of the infraorbital foramen, and I want to know where the tip of my cannula is at all times. So I'm palpating and I'm moving around a little bit, and there I feel it. I'm right here in between the infraorbital foramen and the infraorbital rim. Now I place a very light strand, and actually I should be showing this with Astellas Soft, but I love Radiesse, and you know, it doesn't give me any edema in this area. I move towards the infraorbital rim, I put my finger on it to protect it, and I advance the cannula until I feel it touching my finger. Okay, so right next to the infraorbital foramen, I give some product. Okay, and I retract and I give another little bolus. And I retract and I give another little bolus.
Okay.
I move to a little bit more superficial plane, just around the infraorbital foramen, because she does need a little bit of filling there. So I just place it very less deep, not on the bone, so I don't get any compression there. And then I feel what I've done. Okay, so I feel a few bumps, and I just gently massage it, because I don't want to flatten the boluses, because you know, we want to keep the boluses intact as much as we can, because the more lifting power we want, the more we have to leave the boluses intact. So as you can see, we've only injected half a syringe. And let's just have a look at the difference between the left and the right side.
Yep, that's impressive.
Can you see that there's been a lifting? Let's look at the right side. And now look at the left side. Has she improved?
Yes, very nice.
Yes. Okay, just to finish up, because we're running low on time. Okay.